People who are psychologists, mental health professionals, have an important role to play in the treatment of any patient with chronic illnesses, ME included. What we need to do as mental health professionals is first validate the patient's experience. We have to listen and become an ally of that individual and basically really try to understand what they've gone through to build an empathetic bond. That's so important because particularly patients with ME have been so victimized by often the medical community and others that that particular relationship is critical to basically let that person know that we believe in them and we basically care about them. I think without that basic trust, you'll make very little difference and you'll basically, the mental health professional will actually be harmful to the patient without building that trustful relationship. Patients with ME need to have the best team possible, involving multidisciplines to basically have a good chance of getting quality care. But you can't just send a person with ME to a psychiatrist or a psychologist. The reason being because they probably need many other services that will help them deal with the many different symptoms of this illness. Just think about it. If a person with cancer came to a medical doctor and the doctor said, go see a psychiatrist or a psychologist, that's all you need, the patient with cancer would be terribly upset. And that's exactly what's happened with patients with ME throughout the world. There are many different types of treatments for ME, and I'm going to really talk a little bit more about what I think of as kind of in the lifestyle area, and the reason is because I'm a psychologist, but in the medical area there's also many good treatments for things like pain and sleep difficulties. But in terms of lifestyle issues, often patients feel like they have an energy of maybe 10 or 20% that they had formerly in their life. So their battery, their storage of kind of that electrical life force has been reduced, and yet their obligations are often to be doing twice as much work as they have the energy to do. And that's a problem. So in terms of lifestyle management, how do we get patients so that they're not doing too much, so that they're basically exhausting themselves and possibly entering into post-exertional malaise? So I think in a sense, learning how to stay within the energy envelope, what we call it, I think is critical to allowing that battery not to get further depressed and depreciated. That's, I think, what we need to do. And a lot of patients are kind of what's like a yo-yo. So what happens is they sort of are really sick, they don't do much, and they're really careful, and then they feel a little bit better, and then they do too much, and then they have a crash. That's a yo-yo effect. And I think everything possible to have that not occur is really critical in lifestyle management for patients with ME. You know, cognitive behavior therapy is something that's used with all types of medical illnesses with some very positive results. Why is it so controversial with patients with ME? Well, the reason is because often that's all they're provided. So, for example, a person who had epilepsy and needed medications, if they were basically said, well, just use cognitive behavior therapy, the patient with epilepsy would be furious. But that's what's happening with ME patients. They're basically having needs that are far beyond just psychiatric issues. They have somatic problems. They've got physical dysfunctions. They've got irregularities that are biological. They need the best of medical care and treatment, and yet they're being siphoned to basically a very narrow type of perspective. That's why they're upset, because they're not being given what's appropriate medical care. They're being given inappropriate medical care that basically isn't meeting their needs. A number of people have been talking about pacing, some developments Ellen Goodsmith in Great Britain has written about. We in the United States have used something called the energy envelope. I think there's a lot more commonalities than differences between these approaches. Basically, what they both are suggesting is that we need to help patients learn to kind of manage their available energy in a very sensitized, tailored, contextualized way. So for example, if a person has a battery that's maybe 20 or 30, and basically they once had a battery that was 100%, and now it's just a fraction of that. How do you basically do all the tasks of life on such a small amount of energy, available energy? So what we try to say is pacing, or basically staying with the energy envelope, is trying to sort of stay within that available energy and not exceeding it, not pushing oneself. Because if one does that, ultimately, I think one experiences more crashes, more post-exertional malaise, which I think ultimately does more oxidative stress to the brain, and I think will have some very negative consequences for the patient. So yes, pacing, energy envelope, those are the, I think, appropriate types of lifestyle changes that can make improvements, not cures, but improvements to many patients.
Heeft u een vraag naar aanleiding van deze video? Reageer op YouTube of tweet naar @me-cvs-vereniging of mail naar wvp@me-cvs-vereniging.nl. Uw vragen worden zoveel mogelijk behandeld in de chatsessies.